are two types of anesthesia. In general, it's general anesthesia and local anesthesia. In local, we give different types. Like if it's upper limb surgery, we just block it by a block. Or if it's a lower limb or abdominal surgery, we give a spinal or epidural anesthesia and we block the organs below the stomach. So general anesthesia is, on the other hand, totally paralyzing the patient, making them to sleep and allowing the surgeons to do what they want to do, and will reverse the anesthesia. So basically, these are the two types of anesthesia. Actually cover 5 different things. So pain, patient's movements, and his memory. He shouldn't remember anything that happens during the surgery, and then his consciousness. So these things we induce while inducing the anesthesia, and we have to maintain all this. So each thing is covered by one particular drug. So we use different types of drugs, and while reversing, we will reverse only the muscle relaxation. So we have paralyzed the patient. So we have to get back the muscle tone of the patient. So we reverse the muscle paralysis, and the other things, when we cut off the drugs, like the consciousness will come back, the memory will be regained, and pain is also taken care of different analgesics like opioids and paracetamol or diclofenac. In regional anesthesia, what I told, like spinal or epidural, when we block with a particular drug, that drug we give according to the duration of the surgery. So if the surgery, just that surgeons tell like it will get over in 1 hour, so we give accordingly. So, but the thing is, we can't block only the pain sensation. We block everything that happens in the lower limb or abdomen. So muscle tone, touch, pressure, everything. So all these components, it takes different time to come back. So approximately in regional anesthesia, patient regains his power sensation in 2 to 3 hours. In general anesthesia, it's immediate. Some sedation or numbness will be there, but approximately by 2 to 3 hours, there will be complete recovery, and he can have the food by 3 to 4 hours post surgery. Yeah, like it's very important, because before giving to the anesthesia, we do something called pre-anesthetic evaluation. This is very important because, as I told, like many of our drugs have allergic potential. So if a patient has dust allergy or anything prior, we have to know it, because we can't use those drugs which have allergic potential on these patients. Similarly, if the patient has hypertension, diabetes, we have to control before like taking to the surgery, because under the surgery there are high risk these things get exacerbated. So BP may fall or may get high. Similarly, sugar levels may fluctuate more, because many of our drugs can cause low sugars and also high sugars. So it's very important so that we optimize the patient for the surgery. So we can advise what can be done to prevent all these complications. So meeting the anesthetist prior to surgery is very important. Previously, it was mainly like a human thing. They used to keep a hand on a pulse and see the chest movement for breathing and all. But now we have our standard monitors which can monitor the vitals. So we mainly monitor the circulation and respiration. So in circulation, we get to know about heart rate and blood pressure. If they are maintained normal, we think that all the vital organs are getting adequate blood flow and everything. Similarly, for respiration, so normally we take 12 to 16 breaths per minute. So we set the same ventilatory settings, and same volume, but we inhale and exhale, we set the same things. And the same things, like we have to mainly monitor the vital organs perfusion and their working. So for kidneys function, we monitor the urine output. For heart's function, the same, the heart rate and the blood pressure. For lungs, the respiratory rate and the tidal volume, what the volume we breathe in or breathe out. So mainly everything, the vital organs which carry their function, we have to maintain the same thing throughout the surgery.